So here is the 5 members of my audience, and here's my last member right there. I'm Tisha Grayman, and I'm going to give my persuasive speech. Imagine with me, you're lounging on a comfortable bed inside a beautifully furnished room, complete with French doors that look out onto a pristine lake. Your significant other is sitting across from you in an oversized rocking chair. Smiling happily, they inform you that breakfast is on its way. Are you at a luxurious bed and breakfast, or perhaps you are in the comfort of your own room on a lazy Saturday morning? Well, I'm at Lakeside Birth Center on Lake Tapps, and it's a Sunday, Wednesday morning, and I've just given birth to my first baby. I've experienced 3 different times that having a baby can be relatively relaxed, surprisingly quick, uncomplicated, and very empowering. In the next 6 to 8 minutes, you will learn how a natural birth, one with no drugs, at a birth center or at your home with a midwife attending, can be a better experience for both mother and baby than your typical hospital birth. First, I will discuss the current belief that the hospital is the best place to have a baby. Then I will suggest an alternative with significant advantages over a hospital birth. And lastly, I will encourage you to become educated about this topic. When I first found out I was pregnant with my first child, I automatically assumed that I would have a hospital birth. After all, my mother had had all 5 of her children at the hospital. And most American women generally don't consider any other options. In a publication released in 1999 on the Center for Disease Control webpage, it said that 99% of American births occur in the hospital. This is unfortunate, as many will miss out on a reaffirming and powerful experience. An experience where the mother is taught and encouraged to work with her body and let her labor progress naturally. In the book, Women's Bodies, Women's Wisdom, it quotes a study published in the British Medical Journal from 2005, tracking 5,000 mothers across America and Canada. It showed that home births with low-risk mothers have a much lower intervention rate than with mothers who choose to have their babies born in a hospital. An example is the episiotomy rate. With the home birth group, it was 2.1% compared to the 21% at the hospital. It also said that cesareans, the use of forceps or vacuum, and epidurals given occurred at a much higher rate at the hospital. It's commonly believed that the more technology and drugs to aid in the delivery, the better. But this is not necessarily true. On the American Pregnancy Association website, who partner with many MDs across America, it says that over 50% of the women who have babies in the hospital will use an epidural anesthesia. It also goes on to talk about the disadvantages to the newborn when using this epidural. Some of them could be respiratory depression, fetal malpositioning, an increase in fetal heart rate variability. All these things increase the need for an invasive procedure like the ones I just mentioned. Once the epidural is in place, the mother must have constant monitoring. This requires her to stay in the hospital bed for the duration of her labor. Now, lying flat on your back is physically the hardest to push out a baby. In contrast, midwives can use different delivery positions that actually work with a woman's physical makeup. There are circumstances where a hospital birth is the best place to be, one where the mother or the baby is at risk. But for the majority, less is more when it comes to medical intervention. An alternative worth considering is to have your entire pregnancy, from your very first prenatal checkup on through to an unmedicated labor and delivery. Take the time to research this matter. You could make an appointment with a midwife at your local birthing center, or you can check out the documentary, The Business of Being Born, from your local library. I've experienced the benefits of natural labor firsthand. I really appreciated having the same person who saw me for every prenatal checkup with me my entire labor and delivery. And I appreciated the privacy of only having my midwife, myself, and my husband through the entire labor and delivery. There was nobody else coming in and out of my room. I loved that my baby's immediate introduction into the world was having warm towels wrapped around her and being placed in my arms. And the absence of intervention enabled a quick post-delivery healing. Now, there's understandable fears surrounding a non-hospital birth. what if something goes wrong and there's an emergency situation? Does medical insurance even cover a non-hospital birth? And the question I get the most is, what about the pain of contractions and delivery without narcotics or an epidural? From the documentary The Business of Being Born, and on the publication I previously mentioned from the British Medical Journal, it says that home birth with a trained midwife are proven to be just as safe as a hospital birth. Also, midwifery programs, such as the one at the University of Washington, require a BA or a BS in nursing before you can even begin the extensive training to become a certified midwife. This prepares them for the complications that might arise. A midwife must also take into consideration the physical limitations of the mother before they agree to let them be their patient. Now, there's varied success with the insurance. In my case, my midwife worked through virtually every insurance company out there and also DSHS, but that's not true for every circumstance. And yes, of course there's pain, as there's pain with hospital births as well. But this is not the screaming out of control pain depicted in so many movies, and there are many techniques available to make the pain quite manageable. Having a baby is a natural part and a privilege of being a woman. Our bodies are designed for it. If we continue with the same current medical trend, you can easily imagine the cesarean section, which the March of Dimes says is 1 out of every 3 births, to continue to rise. But by encouraging women to turn to the empowering, healthy place of natural childbirth, it will bring about a much-needed change. We will see the C-section rate decline. We will see mothers recovering much quicker. We will shed the misunderstandings and fears associated with natural childbirth, and we will allow hospitals time and room to devote to emergencies. Right now, I'd like to show you a short clip from the documentary A Business of Being Born.
I like to see them in their homes. The rationale for that is, first of all, they're going to have the baby in the home. Secondly, I'd rather be on their turf than them be on my turf. I'd rather them build like a comfortable ambiance that I get to see them in on a regular basis, so that by the time it's time for the birth, I know where their rooms are, their bathrooms. And it's pretty much just the philosophical underpinnings of giving the power back to the woman.
I firmly believe the most positive place while experiencing the miracle of birth is in the loving, calm atmosphere of a birth center or your own home with a midwife attending. Help yourself by becoming educated, pass along your knowledge, and encourage others to do the same. If you don't, we could lose out on the amazing experiences of natural childbirth. By turning to midwife birthing, we will learn to trust our own bodies, and we'll be able to bring our babies into a peaceful environment. Investigate the many websites, books, and other media out there, and one simple way to become educated is to watch The Business of Being Born and then pass along your knowledge.